Hi, everybody. This is Lee, and I'm talking about Bernie Sanders on his tour, his Unity tour with Tom Perez. And apparently, they ran into some wrinkles in the state of Nebraska, supporting a candidate that Bernie Sanders considers progressive, but who has co sponsored legislation that is considered anti-choice or anti-woman, anti-abortion, anti-healthcare. And so this has raised up controversy, and Bernie Sanders had to answer on his support for a candidate who did not support the choice of a woman to have autonomy over her own healthcare choices. And so there's pushback from this direction and this direction. And I'm speaking on this because I've spoken on it previously. And to my surprise, there is so much pushback on my channel. Usually there is when I speak on women's issues. And I've been trying to figure out why. And so I went into my analytics, and turns out 75% of my viewers are men. And so there we go, I guess. I'm just putting one and two and one together, and seeing what I'm coming out with. But I said maybe that's why. And I kind of had that feeling from my comment section that it was mostly men. And that's what I attract. And so on most issues, they agree with me. On women's issues, not as much. Certainly not on abortion or women's rights or reproductive rights. And that many take the view of Bernie Sanders saying that this is a social issue, it's a cultural issue, while he wants to focus on economic issues because everything else is a distraction. And so I think what people are forgetting is that women make up 51% of the electorate, and they have pushed back, and Bernie Sanders has backed down. And so I think people really underestimate the energized state of women in our country, and women who are voters, and the fact that they are tired of compromising on this issue of health care, which abortion is a part of women's health care, that for whatever reason, that there may be a time when a woman cannot carry a fetus or a baby or infant to full term for so many various reasons that it cannot really be legislated. And it's a private decision, I feel, between a woman and her doctor, not between a woman and the Trump administration or whoever, that it is actually a private medical decision. And it's been kind of flip flopped on and backed off by the Democratic Party, even people who consider themselves progressives. Even Hillary Clinton seemed very ambivalent, saying it should be safe, legal, and rare. Kind of being very judgmental, again, about a decision that is between a woman and her doctor, and that it's a private decision. Family planning is a private decision. Reproductive rights, healthcare choices, these are private positions or decisions between a woman and her doctor. And that even our most progressive member of the Senate seems to be dismissive, saying that this issue is low priority in the larger scheme of things that he considers important, such as economic issues. And I think missing the point that actually access to healthcare has become an economic issue, for the reason that many people of a certain poverty level or low income women actually use Planned Parenthood, for instance, as their main source of health care. They use the clinics for cancer screenings, STD screenings, contraceptives, counseling, education, breast cancer screenings, cervical cancer, ovarian cancer screenings, because they cannot afford to go anywhere else. And then for the Trump administration to defund access to these services by cutting off Medicaid or federal funds, then it actually is an economic issue, because these women cannot afford to pay for health care elsewhere. They cannot afford to go to a fancy private gynecological clinic. Maybe they can barely meet the Obamacare payments and then premiums, and then maybe they can't meet the deductible, or they don't happen to have the copay when they need it. And then also there's restrictions under Obamacare that federal funds cannot be used to access abortion services. And so it actually is an economic issue that affects women. It's very important. And the fact that low-income women are the ones who are being hurt, and that supposedly Bernie Sanders is a champion of the low-income people. Certainly, he says he's a champion for women, and that he's a champion for access to health care for all, including low-income women. Right now, it's being restricted. So there's a problem. There's an economic problem. It's not a social problem. It's not a cultural problem. It's actually an issue of economics, and then also of healthcare. And so, hopefully the dismissive attitude that I've noticed from Bernie Sanders on this issue kind of readjusts a little bit. Again, women are half the electorate, more than half of the electorate. And so maybe, there might be a change. I don't know. I don't even know if on my channel there'll be a change. I mean, I fully expect the comments. But I do want to say, for the women, the 25% of the women that watch my channel, holler if you hear me. I am going to say this for women who have concerns. Most have already taken advice that I've given, that you need to run for office. You need to come for your seats. You need to come for 51 seats in the Senate. You need to get those seats in the House. You need to start running for office. You need to start legislating, not just at the federal level, but also state by state, because there are restrictions being placed on women and their access to health care at the state level as well. That it seems like majority male legislative bodies are forcing women to ask for permission to make decisions about their own bodies. And the only remedy, really, because we've had years and years and years of this same thing happening back and forth, is that women need to run for office and start holding seats and not giving those seats up, and legislating and making sure that it's clearly understood that women will protect women's rights, certainly family planning, reproductive, healthcare, and economic justice rights. So let's see where this goes. Good luck.